Welcome to Group 3's presentation. Today we'll be discussing differing cultural attitudes towards government advice to wear face masks during the COVID-19 pandemic. We also look at how these differences impact the effectiveness of government policy during the pandemic. We will be looking at this through the lens of Asian culture, the United States response, and New Zealand's leadership all throughout the COVID-19 pandemic.
The cultural context plays a key role in the use of masks by people whose attitude towards wearing masks arise from this cultural content. Thus, wearing masks in the community is kind of cultural behaviour, and consequently, the cultural resistance is the most important obstacle compared to other obstacles. Until recently, a medical mask would have meant that you were sick, therefore people would reject. Despite the importance of wearing face masks in preventing COVID-19, unfortunately in some societies there are obstacles such as lack of awareness of the effect that masks have, economical barriers, and physical issues. Globally, at the beginning of the COVID-19 pandemic, homemade masks became popular among crafters, sewers, and anyone with free time. Universal reasons for making homemade masks were due to the shortage of surgical masks and preventing the spread of COVID-19. For example, the Indian government recommended their people to wear homemade masks, and they put out detailed instructions on how to make these DIY face masks. The supply of face masks is decidedly a thorny issue for governments, as no affected countries and regions can claim to have enough stock to satisfy both the need of its medical personnel and the public. When confronted with the choice of whether to wear a mask to avoid infected with COVID-19, there is evidently a big difference in between China and Western Europe and the United States. The governments and media in Western Europe and America generally discourage the practice of mask wearing by healthy people, whilst in China the issue of masks find no dispute at all from government down to its citizens.
Hi, my name is Charlie, and today I'll be speaking about the US's response to face masks in relation to topic 1. I'm really excited to talk about this as I found it really interesting researching about the United States and its response to the pandemic. We are going to look into the Trump government's stance on masks and also the US's response. We are discussing cultural attitudes about government advice. So to do that, we need to know what the government's advice is. On April 3rd, the Centre for Disease Control and Prevention recommended the use of face masks, which at a press conference later that day, President Trump stated he didn't think he was going to do it, as in wearing a mask. He's also on the record for mocking people for wearing masks, and he wasn't seen wearing one in public until July of 2020. I read a great article while researching for this, and it's from the International Journal of Health and Sciences, and it's estimating the COVID-19 related deaths attributable to President Trump's early pronouncements on face masks. Robert A. Hahn goes into if the president says the use of masks is voluntary and that he will not use one, to what extent is he then the cause of deaths that result from non-use of masks? This can be directly from people who hear him or indirectly through the media or social networks. We can also take that one step further by looking at the deaths counted of the non-mask users themselves and the people they then infect. I'm going to look at some factors of the US response to masks. In the early stages of the virus, there was not enough sufficient evidence to say cloth face coverings were effective in minimizing the spread of the virus. Due to insufficient stockpiles, the public were also instructed not to buy N95 masks as they were needed for healthcare workers. In Module 4, we spoke a little bit about geopolitics and types of government. America's government is a presidential republic, but they also operate within a system called federalism, where certain powers like schooling and safety are designated to local governments such as states, cities, and counties. The Trump government designated COVID response and regulation policies off to these states, cities, and counties, making them responsible for their own. I've done a lot of research, and many have said that this is particularly strange for a global pandemic and health crisis of this size, especially to the extent of how bad it was in the US. Some states ordered mask mandates in April of 2020, with most other states following in July of 2020. But many other states also didn't have mask mandates until September and October. One of the other reasons for the huge backlash towards masks in the US was because it was seen as a partisan issue, Democrats versus Republicans, and this can be related directly back to Trump's comments in April, saying that he wasn't going to wear a mask. Many American citizens saw mask mandates as the government taking away their freedoms and First Amendment rights, rather than a way to stop the spread of the virus and save not only themselves, but others. I'm going to look at some facts. It's interesting to look at the US's response in comparison to another country that responded fairly well, such as New Zealand. Katie is going to look into this a little bit further for us.
We're going to have a look now at New Zealand's response to wearing face masks and how they manoeuvred their way through the COVID-19 pandemic. Originally, face masks were not widely adopted by the community in New Zealand, only for people with professions that required face masks. And when COVID-19 started, there was a lot of public awareness around washing your hands, coughing and sneezing into your elbow, and staying socially distant. As the numbers increased and the beginning of the pandemic really hit New Zealand, they went into a very strict stage 4 lockdown. And Jacinda Ardern was very public in a positive leadership style, coining the term stay home, save lives, so bringing the community into action to help each other come through this pandemic. They then introduced the wearing of masks to protect each other and the community and the nation's well-being, and this was adopted mainly because of positive and open leadership and very clear communication by the Prime Minister and the health organisation in New Zealand. Here you can see Jacinda Ardern showing in a playful way how to make your own face mask, making light of the situation that they didn't have enough face masks at the time, but also promoting the idea that they were helping protect each other's lives, saying in a joking way that this is my first time crafting and I'm going to pull out my glitter gun later. So here she's just showing that she's with her community doing the best they can. The community responded to the government regulations very positively, and the results can be seen in the cases that rapidly declined, and the country was able to come out of the harsh lockdowns and return to business as usual, faster than most countries in the world. And the community is now used to cooperating and supporting varying levels of COVID restrictions, with masks being a commodity that is worn to protect each other and the nation. Here you can see a graph of the rapidly declining cases in New Zealand, bottoming out at 0, which is something they've been able to maintain really well ever since. By looking at different countries and how government strategies and legislations put into practice of wearing face masks, we could see that community responded in different ways. In China, for example, masks were part of their culture and adapted by their people long before COVID-19 to stop the transmission of any viruses. The United States went into the bit of turmoil with the president mocking and dismissing the mask wearing, and we can see the rise in cases that were not brought under control. And in contrast, New Zealand, who were very strict but also very clear and kind in their messaging, and the Prime Minister modelled positive leadership throughout the pandemic and all the uncertainty, and the community responded respectfully and cooperated to protect the nation's health